Please type in your name, the organization you're with, a description of what your org does, as well as the type of funding you think you'll be pursuing if you already know that. Like I said, this is being recorded, so this will be on the Marion County Community Services website. Please type your questions into the chat. We're going to answer as many as we can today, but then we're also going to post a Q&A if there's any questions that we don't get to. And there will be some times throughout this presentation that we'll ask you to unmute if you have questions, or there's a few places where we would like some of your input as well. Go. Okay, Kayla and Dallas or Cheryl, I'm going to hand it over to any of you.
Good morning, everyone. So thank you so much for joining this call this morning. As we had stated before, I'm just going to say it again before we start, because as you know, with Zoom, there's a lot of feedback. Please make sure that you are on mute. When it comes time for Q&A, then they'll prompt you to unmute, but please make sure you do have your volume muted. Anyway, so with this NOFO, any information or questions that you need, you can go ahead and send a message to me directly. Please email me, not Scott. This will come directly to me with your eSNAPs information and any questions that you have.
Excellent. And then just so you know, Kayla will also be forwarding, if you have technical issues with eSNAPs or whatever, she'll be sending those on to Dreama and myself, which probably reminds me we should introduce ourselves, because Dreama, I'm horrible at doing that. I am Stacy. I'm with North Star Grant Writing, and we are working with your CoC to help get you as much funding as possible. Dreama, do you want to do a quick introduction and just share a bit of your experience? You'll need to know Dreama has so much experience with CoC. You guys are in great hands. She's a guru on this.
Good morning, everybody. I'm glad you're here, and I'm happy to be here. My name is Dreama Shreve-Ketron, and I have done CoCs for over 20 years. I have started them. I have doubled PPRN into ARD for folks. Helped write the Hearth Act. What else have I done? I'm one of HUD's housing experts. So if you have questions, just yell at me. Don't hesitate.
There you go. So I'm going to just So here's kind of an agenda of where we're going. At any point, if you have questions, raise your hand, drop it in chat. We will have Q&A at the end, but if there's a slide that we're on and you're really confused by it or whatever, please just let us know. So I want to give you just a quick overview of what's going to happen between now and September 28th. So for those of you applying, doing a project application, you are going to work on it in eSNAPs, but do not hit submit. The only thing you're going to hit submit on is your profile. You'll hit complete, not submit. But then when you're done with your project, basically with your application in eSNAPs for now, you're going to save it. You're going to export it into a PDF. We'll get into the details more throughout this presentation, but you're going to be emailing that to Kayla, and then Rating and Ranking will review it. They'll score it, and they might tell you it's been recommended, reduced, or rejected. And that is why you don't want to hit submit, because we'll look at the total dollars available to the CoC. We might need to ask you to adjust your budget. There might be words that we'll ask you to revise just to make it stronger. So you don't want to hit submit, because then it allows us to make some changes to it. And then after that, so Rating and Ranking is going to review it, and then they're going to notify you. We'll get to the timeline of that later on. I forget the exact date. And then we will do the collaborative application that will get posted on the Marion County Community Services website, and it'll be available for public comment. And then that will get turned into HUD September, probably 27th. The 28th is the actual deadline, but eSNAPs typically crashes and won't be working by then. Okay, Dreama.
Okay, so local funding priorities is to maximize the use of mainstream benefits. Of course, everybody knows that. Coordinate and enroll participants in healthcare. Make sure you do that based on via SPDAT needs. Help participants understand the services that are available to them and secure funding for these services outside of the CoC. So there's lots of opportunities out there, and we can help find services if you're in desperate need of something, or funding, not services, but funding. And we need to work to remove barriers to local resources, prioritize those most in need, participate in no wrong door, coordinated entry, and assessments, and reduce the number of people exiting for unknown reasons and places in the HMIS, and decrease the length of time a person is homeless. So I know you all do a pretty good job of that, but we need to work harder at doing a better job.
Okay, what you're seeing, these are HUD's policy priorities. This is not coming from your CoC. This is coming from the fiscal 22-26 strategic plan. So the goals, number one, support underserved communities, ensure access to and increase the production of affordable housing, promote home ownership. Number four, advance sustainable communities. Number five, strengthen HUD's internal capacity. So you can unmute. We're not going to look at number five right now because that is a HUD related thing. As a CoC, we're not going to approach that. But what are some things we can do as a CoC to be hitting goals 1 through 4?
Anybody?
Hi, this is Yolanda East. I think that on number one, as the CoC, we need to probably have a committee to find those underserved. Definitely we need to explore, because, times have changed. We're seeing more elderly that are homeless than we had before in our community. At least here at Shepherd's Lighthouse, we are. So I feel like we need to definitely, work on finding out what those underserved people are and how, as agencies and as the CoC, how we can help better utilize our dollars in that way.
A great place to start with that. That's a wonderful, wonderful chime in, is your outreach team. Your outreach team is who can connect you to your underserved communities.
Yeah, I have the outreach team, at least one of them. We also have a separate veterans person that does outreach for them, and Interfaith has an outreach person that does outreach work. So, we go into the encampments in addition to any of the call-ins that we get, and schedule the call-ins in between the encampment visits. So we have 4. I think the VA has 1 and Interfaith has 1.
That's great. That's great. And build with your diverse subpopulations. Add those to your outreach teams. Youth, DV, people with lived experience, people who's lived in permanent supportive housing for a couple of years. See if you can get them involved.
I know that we work very well with Robin and here at Shepherd's Lighthouse, and I just want to give her a high five on their hard work going out to the encampments and finding people in the highways and the byways.
Thank you very much. We find that we don't have a lot of success in getting them straight into housing with a lease from the encampments. But if we can convince them to go to shelter, we have much better luck working from there.
Yeah. And that's great knowledge right there to know what's most effective.
But we don't have a long-term shelter, or we have very specific guided shelters here in Marion County. for homeless mothers and children. Of course, Salvation Army takes in men and women and children. And Interfaith takes in families. Here at Shepherd's Lighthouse, we do women and children. But some of these people that are in these encampments that are on very high on our list don't have anywhere to go to receive services. So I feel like we need to, as a COC, definitely reach out to Robin and see if there's some way that we can, because she has nowhere to put these folks.
Yeah, I
And
mean, the good thing is that, you know, Open Arms is transitional housing that does work with the men that are just getting out of you know, incarceration. And we have, you know, the Time for Freedom or whatever they're calling it now that is expanding. So you know, we have some places for men, don't have a lot of places that work with women that are coming out of incarceration, but New Directions works with them counseling wise. So, you know, we do have some places that are working towards that population, because I saw something pop up about the from Sherry about the recently released from incarceration. But Open Arms has been a blessing to us as long as the person can work and they can get into that program and work through that 4 or 5 month program. And then most of them we don't see again. They get into housing and they're good to go.
Stacy, will you go back a screen?
No, that's my issue. I'm sorry. I wanted to double check and make sure I was recording, and in the process I went forward and now I can't go back. So we are here. Sorry about that. I will figure it out later, but it's not liking me right now.
So I wanted to say Carla Grimsley's microphone is not working, but she said that you also have challenges with housing for those experiencing severe mental illness and or inactive substance abuse, which would be co-occurring disorders. We do not have the necessary wraparound service to stably house these individuals. This is something we need to look at with ESG and COC funding in the future and now. So this is a hard to serve population, and substance abuse is, as you know, a national epidemic. So that's another one that really needs to be addressed. Thank you, Carla.
Thank you. Okay. Yeah, so again, sorry, I accidentally switched us to the next slide. Tech and I are not on good terms today, apparently. But I am legitimately going to move us to this slide now, just because I think we've given you lots of things to be thinking through your COC membership meetings and how can we best be serving our underserved populations. But just for the interest of time, I want to make sure that we cover the other things relevant to today's webinar. Dreama, do you want to take this one?
Sure. Your all's estimated annual renewal demand, that's your ARD, is $431,188. So tier one, my husband's leaving. Tier one is $401,005. I don't know why they do this. It's just to keep you from putting more in there than your renewal demand. But there's no way to take out $30,000 of one project and put it in tier two. So your renewals will go into tier one. And your COC bonus is $167,436. That is available to fund new projects. And then you have a DV bonus this year of $239,233, which is also new money for new projects. Tier two is the difference between tier one and the maximum amount a COC can apply for.
That'll be an hour.
Okay.
Or I'm not sure how long this lasts, but
I'm gonna go to Tire Kingdom then,
okay.
because the low.
If you can just mute yourself, if you don't mind, please, and then we'll have Q&A later on.
Additional funding is your PPRN. There's $1,961,123 of PPRN. And you have spent $431,000 of that. So there's a lot of room for new projects and expansion projects. And the CoC planning is 119,617, and that goes directly to the CoC itself. So any questions on that?
Yeah, can you further explain this PPRN? I know this is a lot of acronyms. Some people on the call might not understand them all, but that's a lot of money for new projects. So I just I'd love to have just a few more minutes of your time just explaining that.
Absolutely. Your PPRN is pro rata need amount. It's your preliminary pro rata need amount. So when HUD started continuum of care, Congress mandated that they give each county, each municipality, a designated allocation for homeless services in that area. And if you take it's actually 2 million and some dollars for your area, but you've spent 431,000. So if you'll add the 431 to the 1961123, you'll have your total PPRN. And I don't know how I didn't get that on there, but it's over $2 million. But there's $1,961,123 left for new projects that has not been claimed by your CoC, but it's allocated to your area. So it's out there.
Basically,
Pro rata
the way
need
I
amount.
explain it is your full PPRN, which we're only showing the portion that hasn't been tapped into. So it's the amount you see plus the 431. So it comes to about 2.4, 2.5 million. But that full amount is what HUD has essentially allocated to your continuum. They're waiting for your continuum to come to them to say, this is how we can use it. Here's our plan, and to prove that the plan is solid and you have the track record to implement it. So it is essentially money that they're sitting on wanting to give you. You just have to demonstrate through your projects, this is what we're going to do for them to give it to. Anyone have questions on that? And there is the DV bonus. We will get to that. If you're in, and you don't have to do it now, it might be when we talk on it more, but if you're interested in DV bonus, if you'll just drop that into chat, because we're just trying to get a pulse as to how much interest there might be on that. Okay, what is new this year? Oh, I always get stuck with this slide. This is so hard for me to say. Affirmatively furthering fair housing. We're going to call it AFFH because I cannot say it. It's a critical tool against housing discrimination and segregation. This is one of the new things that HUD is looking at this year. It is in the rating and ranking, the score sheets. So make sure you're talking about how your organization and your project are hitting this. If you want to unmute and just talk about why, like in a few words, why is AFFH important? Anybody?
This is Gwendolyn Dawson. The primary reason is important because it creates an opportunity for equal opportunity for everyone to have access to housing, and it helps to deter or curtail the discrimination that the communities are facing, the residents of communities are facing. And a lot of times when we're doing advertising or marketing, we're marketing to a particular targeted group. But if we're going to do it in a fair manner, we've got to make sure that we market and advertise to those targeted groups that we least likely would have access to the services and resources that we have control of.
Beautiful. Yes.
Absolutely.
So again, I'm going to just say this is somewhat of a trick question to some degree, only because you're not going to have a question in eSNAP saying, what are you doing? What is your project doing to hit this? And yet you will be scored on it. So keep that in mind as you're working on your application, because you're going to have to answer this, weave it into your other narratives, but it's not going to ask you specifically.
We have a question on the chat that I would like to address if you all don't mind. We were asked about obtaining money for construction. The CoC, well, let me back up. The continuum of care process through HUD does allow for new construction, acquisition, and rehab. However, if you use the CoC dollars for that, it ties up the money. It dings the HMIS because there's no data put in. And all that money is going for a project that seems like you have an 18-month window to spend it, but HUD is going to tie you up in CoC red tape for 18 months before you can ever draw a penny of the money down. So it always ends up being a quagmire of mess, and we suggest highly that you do not allow that as a CoC.
Thanks for that, Dreama. Okay, Dreama, you want to take this one?
Sure. Serving DV. All projects may use new BLIs, budget line items, to serve DV and VAWA clients that present at your project. So assistance with moving cost, reasonable moving cost to move survivors for an emergency transfer. Does everybody know what an emergency transfer is?
Yeah.
We'll go into, go ahead.
For us, with emergency transfer, when we have a VAWA, we call it VAWA, but a domestic violence family who's a victim of it, we do an emergency transfer, break the lease. The landlord has to comply with that. And in our emergency transfer plan, we actually have MOUs with other housing authorities to do trade-offs of families when the units are available.
That's great. That's great. Yes, there. An emergency transfer is when the abuser and the victim are cohabitating in the same unit. You can move the survivor, or you can move the abuser, whichever one is best. Usually it's move the survivor and or children, if they're involved, to a non-disclosed location. And the VAWA laws within the CoC state that you can charge the abuser and remove him from the situation, or her, whoever, remove the abuser if that's what needs to happen. So we can get into that. We'll probably do another presentation on the DV, just because there's so many of you all interested in it, and we will go into the emergency transfer details. But you can also, and this is for every project that's out here, you can add assistance with travel costs, reasonable travel costs for survivors and their families to travel for an emergency transfer. So you guys are in Florida, but maybe the survivor and the kids want to go home to Minnesota to her parents. You can buy plane tickets, you can get bus tickets, you can, like you said, move them to a different county and do a trade-off. So all that is reasonable costs. Security deposits for emergency transfers, and that includes utilities as well as a new rental unit. And of course, utilities is down here for emergency transfers.
Dreama, do you want to continue? Yeah.
Yeah, I'll continue. Again, all projects can use these line items. There's housing fees. We all know what these are about. Trash fees, pet fees, broker fees, whatever it takes to get them moved and to keep them safe. You can do security systems this year for your DV. Be it Ring doorbells or security cameras in their units, outside their units. Care and case management, staff time can be paid for in there for implementing and coordinating emergency transfers. Housing navigation, we all know what that is. and technology to make a unit safe. Again, there's security cameras, phones, internet service, Ring doorbells, whatever needs to go in there to keep them safe, make them feel secure. And everybody can put that in their budget as part of their budget this year, even the renewals. If you run across or serve any DV clients.
So Dreamo, here at Shepherd's Lighthouse, we have a DV bonus, and that was one of project that we work with. That's a renewal, and that's what one of the questions we were trying to find out is because we do have a couple of the grants through HUD and through the NOVO. And we've been working on renewing them, and we haven't worked on the budget pages because this is the first time this has shown up since we've been doing it.
Yeah, this is
we
new.
weren't exactly sure how to break it down in the budget to make it match what we were having, or do we increase the budget, or do we have to do an additional project?
Okay, you cannot increase your budget. What you project. But there is a
Will you
new
repeat
line
that? You
item in
froze.
everybody's budget that says VAWA. So if you want to move some funds into that, you can.
Hey, Dreama, this is Monica. Is the DV bonus different from the renewals? So does an agency, one of our agencies already have the DV bonus?
Oh, okay.
Shepherd's Lighthouse does have a DV bonus grant.
Is that the
But
DV
I
bonus?
believe there's additional funds for additional DV.
So you have the renewal. I didn't know, I thought, Cheryl, are you on here?
I'm on here.
Is there a difference? Or did I?
So if you're a renewal, then your number on that, I would go back, but I can't go backwards today, which is so weird. I'll figure it out. So on the slide that it showed the ARD, your renewal is now going to be part of that ARD, or the annual renewal demand. So the bonus will be new funds for DV. So your existing DV project will be a renewal, not coming out of DV funds. DV bonus, excuse me.
Okay, so there is still additional DV bonus funds there.
Yes.
Okay.
Unfortunately, I just can't back up to it. Yeah.
Okay,
And there's also $1.9 million up for grabs besides the DB bonus. So there's enough money there, I think, to cover everybody.
oh yeah.
Okay, so continuing from what we were just talking about, this is with the DV with the VAWA, but this is not exclusive to the DV bonus. So you can shift up to 10% of an approved eligible activity to another eligible activity without permission from HUD. So this actually doesn't even matter if it's a VAWA activity or not. If you have something in one line item and you want to shift it to another line item, you don't need HUD's permission if it is under 10% or up to 10%. Okay, Dreama, you want to take this one?
Okay, new this year, DV-based revised definition of homelessness, domestic violence and other dangers or life-threatening conditions. Notwithstanding any other provision of this section, the secretary shall consider to be homeless any individual or family who is fleeing or is attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions in the individual's or family's current housing situation, including where the health and safety of children are jeopardized, and who have no other residence and lack of resource or support networks to obtain other permanent housing. What this means is individuals fleeing or attempting to flee due to domestic violence no longer have to be classified as chronically homeless. They are immediately considered homeless. So you don't have to have that third-party documentation or anything else. If they present their DV, you have to take them at their word. You can work on, you know, legal aid and all this other stuff, medical if they need it, and get that documentation later. But for the immediate, you can serve them. They don't have to be chronic.
Okay, another new change this year. COCs can receive up to 14 points on the collaborative application by including new projects that created through reallocation or COC bonus that are utilizing housing vouchers and healthcare provided through an array of healthcare services. So as a reference point, I believe last year the median score was about 155, I want to say. So to get 14 bonus points for the whole COC is no small thing. Translation, if you are going to come in for a new project, I'm not even going to just say we highly recommend, like you pretty much need to ensure that you're doing something that is using housing vouchers or there's healthcare, and highlight that very heavily in your narrative. Again, there might not be a specific question. What are you doing with housing vouchers? What are you doing with healthcare? You need to make sure that you're answering that, even if you aren't prompted in eSnaps. You need to weave that into your narrative. Dreamer, you want to take this one?
Sure. Youth age 24 and under must not be required to provide third-party documentation. This is new as well. They meet the homeless definition as a condition of receiving services funded through the NOFA. Any youth serving provider funded under the NOFA may serve unaccompanied youth age 24 and under or families headed by youth age 24 and under who have an unsafe primary nighttime residence and no safe alternative to that residence. These youth-related requirements supersede any conflicting requirements under the NOFA or the CoC program interim rule. So this is great. If you have homeless kids or a mom with kids that's under 24, they do not have to have third-party documentation anymore that they are homeless. Does anybody serve the youth?
I think everybody does. We have Arnett House that does the 18 and under, and then we're all the outreach handle the 24 to 18. And we don't have any unsheltered youth, but we do have youth in the shelters.
Oh, that's great. So they no longer have to have that third-party documentation of, you know, where did you stay last night or whatever. They can just come in and be served.
Okay, eligible types of new projects. This also includes those applying for DV bonus. And I was able to peek at the chat. It looks like we will be doing a webinar specific to DV bonus. But regardless of if you're doing DV bonus or a new project, you can apply for rapid rehousing. Make sure you're utilizing a housing first approach. It's dedicated to serving survivors of domestic violence, dating violence, or stalking. And actually your new project doesn't have to be limited just to DV. Think we changed this and missed something on it, so I'm sorry for that. So your new projects really can be about rapid rehousing. Your new projects can also be joint transitional housing and rapid rehousing. On the third point here, supportive services, that is your coordinated entry. So the CoC can only have one coordinated entry proposal. So make sure that when you're in eSnaps and you have the drop-down options, you are not saying that your proposal is for supportive services unless you are the coordinated entry provider.
I have a question back on the
Found it.
youth.
You're backwards, Jay.
I went backwards, people. It's the small things.
My question is regarding the family unification vouchers, FUP vouchers. Would we be able to propose using any of the funding to help house any of the FUP families? Because the big issue they usually have, all our clients, would be the security deposits and the moving costs. So if we had a FUP family, and we do have those vouchers, could we maybe propose to use a small allocation or a portion of it for that purpose? Or do you think that wouldn't be as competitive?
No, I think you can do that. Also, ESG funds are now geared to pick up those specific kind of projects. ESG rapid rehousing budget items are a little different from CoC budget items. And that was done purposely. ESG does HPRP. Do you all remember HPRP, homeless prevention and rapid rehousing? When that very first came out, there was I think it was Obama did millions and millions of HPRP funds. All of those HPRP criteria, like you were just talking about, are allowable through the ESG dollars. The CoC, you can do it, and it doesn't hurt your budget at all. I mean, it doesn't hurt your program at all. But you don't want to make it really heavy with utility deposits and stuff, but you can put them in there.
Okay.
And I know that wasn't a very helpful answer, but maybe look at ESG.
Okay, thank you.
New projects. The CoC may apply for any number of permanent housing, rapid rehousing, and joint transitional housing, permanent housing, rapid rehousing projects, provided that each application is for at least $50,000. And a CoC can only submit one project application for an SSO, which is coordinated entry. No SSO only projects. Make sure your application is for a minimum of $50,000. Okay. Reminders. You want to do this one?
No, go, how about it?
Okay, a combination of reallocated funds and CoC funds in the same new project. You may use both reallocated and CoC bonus funds in an eligible new project application. So does everybody know what a reallocated project is? Let's say you want to change your scope drastically from transitional housing to permanent supportive housing. And because you're doing more permanent supportive than transitional with your funding. So what you want to do is you want to reallocate the money you're currently getting and possibly use some bonus funds from the CoC to do a new project. And then transition grants. This year, the CoC competition, you can request to transition eligible renewal projects from their original components to another eligible component. To utilize the transition grant process, you must fully reallocate the renewal project funds that will transition to a new component, and you must submit a new project application in eSnaps, which is basically the same thing as a reallocation. The only difference is a reallocation funds, we can reallocate that project's funds to a totally different organization that's putting in a new application. If somebody doesn't want to renew, you can reallocate it to another new project. You all have enough money to play with. I don't think you need to worry about either one of these this year.
I had a question that may fall into this, and that's regarding the renewal. Each year we're stuck at the same amount. How would we be eligible to request a greater amount?
We will do an extension project if your scope is staying the same. You can do a new application for a new project and call it an extension. And after the extension is renewed, let's say you get funded this year for next year. This time next year, you're going to renew that extension project. And after it's renewed, HUD will come to you and combine the two into one grant. So you don't have to report twice on the same stuff and everything.
Oh, okay, that's interesting. Okay.
Yeah. Yeah.
And
We
would
can
you
help you
just
with that.
name it the same thing? Okay,
There's a
would you
question
name
in
it the
there.
same thing?
No, I would name it
Okay.
something different so you don't get confused. It's
Okay.
easy to get it confused in eSnaps because it is not intuitive.
Okay.
Yeah. And if you've got a project, you know what I'm talking about with eSnaps. You think it should do this and it won't.
Yes. Thank you. That's good.
You're
news.
welcome.
Rima, along
And
those
we're here to
lines,
help you all through all this. So don't worry.
do you want to do the 30-second overview as to how it adjusts with FMR versus how, like, different ways of defining your project where it's increasing with FMR if you have it defined under certain terms when you do it? Do you want to explain?
Yeah, sure. I'll be happy to. So FMR is your fair market rent rate based on your zip code that HUD puts out every year. It changes. So as your area's rent increases, and if you're like the rest of us, it's really gone up this year due to the housing market. So if you have a project that is leasing, with the lease being between the participant and the landlord, or you have a rental, tenant-based rental assistance project, HUD will automatically increase your dollar amount at contract signing to reflect your local FMR. However, if you're doing a master lease or you own the building, HUD will not adjust your FMR. So keep that in mind if you need to transition from a leasing project where you're doing a master lease to a tenant-based rental assistance project. You can transition that grant to that this year in your application. Does that make sense? We'll help you.
We'll help you. On the last slide, we're going to show Kayla's email because all of your proposals are going to go to Kayla. But again, send her any of your questions. They're not going to come directly to Dreama and myself only because of your Sunshine Act, just for open records. So we want Kayla to have copies of everything so she has it. But then if you have questions on any of this stuff, it'll get forwarded on to us and we're here to help you through it all. So another important reminder, HUD cannot correct your project application errors, which is partially why we're saying, don't hit submit, because there might be some things we'll walk you through prior to that. But you have to make sure that what you're putting into your project is in compliance with the Hearth Act, the interim rule, and the NOFO. You're responsible for submitting a project under the appropriate type. So if you're saying you're going to do supportive services, you will not get funded unless you're a coordinated entry. So make sure you're paying attention to what you're saying and that it aligns with what HUD is allowing.
However, in the housing projects, you have to have a housing component, but you can do supportive services for your clients in a housing application.
Great correction. Thank you.
The expansion process, we just discussed that, but your organization can submit a new project application to expand an existing renewal project that is also being submitted for renewal funding. So to request an expansion of an existing renewal project through the new project application process, see this section of the NOFO. And I would suggest you name it whatever your project that you're renewing is named, but name it that expansion.
So with
HMIS.
Go ahead.
Go ahead.
You got it.
The HMIS lead is responsible for making sure all service providers for ESG, CoC, and HUD VASH are inputting correct data within 48 hours of service delivery. The HMIS lead is also responsible for reporting the LSA, the HIC, and the housing inventory chart into the HDX, HUD's data exchange. And the HMIS lead is also responsible for reporting slackers to the CoC and implementing corrective measures. So I just wanted to throw that out there to make sure you all are aware this is going to be looked at.
And I'm going to follow up on that. So this slide that you're currently seeing is what the HMIS lead is doing. However, this slide here is what each project applicant needs to be complying with and looking at. So HMIS data, you're looking for reducing the number of people exiting for unknown reasons and places. So look at this very carefully. Each provider needs to have fewer than 3% exiting for unknown reasons each year. So work with your HMIS coordinator to clean up your data prior to submitting your project application. Same thing with decreasing the length of time a person is homeless. Do not leave this blank or incomplete. So on the last slide, remember the last line was HMIS lead's going to work with your slackers. We're kind of calling out what we're defining as a slacker. So make sure that you aren't showing that they're just, exiting for unknown reasons. And this is going to be looked at when rating and ranking is reviewing proposals. This will affect your score. Scoring affects funding. So look at these very carefully.
SSO coordinated entry, only one SSO coordinated entry project per CoC. We used to be able to do SSOs only, but now the only SSO allowed is coordinated entry. Supportive services are in your housing grants. So you have to have a housing component to provide supportive services unless you're coordinated entry. And coordinated entry is responsible for housing coordination, VI SPDATs and the scoring thereof, unified intake forms across the CoC and the outreach efforts. Read the Hearth Act and the interim rule if you are the CE grantee for responsibilities and details. Make sure you hit all those in your application.
Okay, here's our timeline. So your project applications need to be submitted to the CoC. Once again, we're going to pop up Kayla's email later on in the slides, but you're going to send that to Kayla by September 1. And again, it's in your local NOFO, which has been posted on the Marion County Community Services website, but it's going to detail what you need to include in that email. So you're going to be, and I'm going to say some of them, I might have it in the slide, I forget. You're going to have export from eSnaps. Do not hit submit. You only hit submit on your profile, but not on your application, and you might have more than one application. So you're going to turn that into Kayla. Then it's going to go to rating and ranking. By the 13th, rating and ranking will be done, and the CoC will be notifying you as to if your application has been accepted, ranked, rejected, or reduced. If it's reduced or there's things to change, you will have some time to make those changes. Well, as a CoC, we'll also push out an email letting you know when you can hit submit, but it won't happen until after September 13th. On September 25th, the CoC is going to post the NOFO consolidated application for public viewing. For comments, it will be on the website. And then on the 27th, we will be hitting submit and turning it into HUD. So this is coming directly from your local NOFO. September 11th, your rating and ranking will meet to score all the projects. So prior to that, by September 1st at 11:59, we're going to say whatever time zone you guys are in. I didn't change that, my bad.
Eastern. They're Eastern, just
Thank
like
you.
me.
Like that side of the country time. So 11:59 Eastern time. You need to have it turned in, email it to Kayla. Her email is on the screen there. You're going to submit one PDF of the following per project. So you might have multiple projects. So you might have multiple PDFs that are being submitted. So per project, you're going to have a table of contents with each item separated by a title page. So you're going to have your eSnaps application. So again, you've done it in eSnaps, you export it to a PDF. You're going to attach your project policies and procedures. A lot of this is for threshold review, which is why rating and ranking needs this information. You're going to have your match letter, or you're going to indicate when you expect to receive match documentation. If you're a renewal project, you have to submit your APR, and it has to be for the date range listed. If you want to email us and say, are you sure about that date range? I want a different date range. I'm going to tell you right now, the answer is that is the date range that you have to provide. So make sure those dates align with that. As a note, your HMIS projects, their coordinated entry projects, do not need to submit an APR. You're also going to attach your e-logs. This is again for renewal projects. It's a report showing your draws for the most recent operating years, or for renewals operating year to date if the program is in its first year. So this is basically proof that you're spending down what HUD has already allocated to you. And then you're also going to include a cover sheet with all of this. It's going to say the name and the person that is available should rating and ranking have any questions. Make sure you're listing somebody that knows about your agency and about your application and or applications, so that if rating and ranking calls them, they're reaching somebody who is knowledgeable about this. And then you're also going to want one PDF per agency. So this piece of it, it doesn't matter if you have multiple applications, you just need an agency PDF. Again, you're going to have a table of contents. You're going to separate it by a title page. You're going to have your applicant profile that you submit in eSnaps. That one, yes, you are submitting. It's your only exception at this point. Export that to a PDF. And then you're also going to attach your audit if you have one, your indirect cost rate agreement if you have one. I would imagine most do not. So if you don't know what that is, it means it does not apply to you. You're going to attach a copy of your 501c3 if it's not on file already with the continuum. And if you have any monitoring letters or any correspondence from HUD, then you're going to attach that as well. Are there any questions on either of these items, like either of these slides of what you need to attach?
I do have a question. On the HUD monitoring letter, are you referring to any HUD monitoring for CoC funded projects or any programs?
CoC.
Okay, all right, thank you.
Great question.
So on the APRs that we do, we have renewal grants, and we have one that starts in April and ends in March. And then we have one that starts in August and ends in July. And we have another one that starts in September and ends the end of August. So do you want them, do you want us to go ahead and do the ones where it says all must do an APR for those dates?
Yes.
Because okay.
And the reason is it makes it easier for rating and ranking if they're all looking at the same time frame.
Okay. Okay.
Any other questions on either of those slides before I move on? Okay, so here's some of your resources. Once again, we're going to have the recording of this on the Marion County Community Services website. There's going to be these links. The slide deck will be there. If you have questions and You can send it to cocnofo@hud.gov regarding the fiscal year 2023 COC program competition process. If you get a response, you might want to buy a lottery ticket because sometimes well, I think last year I wrote them and I think it took them about 7 months to respond, which somehow was past the deadline. So you can try that route. If you have eSNAPS questions, then you can email eSNAPS@hud.gov about eSNAPS functionality, because eSNAPS is not intuitive. If you have questions just doing certain things on it, you can reach out to Drama and myself. We can help you through that, but there's some stuff that is so nuanced that they might be able to help on that. And then again, Kayla is your person. So you want to submit anything related to COC is going to go to Kayla. Her email is there on the screen. That is where you are going to be sending those PDFs by September 1st. As well as any technical questions, they will then get forwarded to Drama and myself, and we'll be able to assist you on that.
Let me throw in there, before you contact the CoC@HUD.gov, ask Stacy and I, because we may be able to answer your question a lot quicker than 7 months.
Yes.
Can I ask a question?
Yes.
Absolutely.
So I don't know, I didn't catch it for whatever reason, but when you're looking at the type of COC funding that the project's applying for in the program competition, I didn't quite understand the reallocation, but in that question in a new project that I'm writing as an expansion, it just gives you reallocation, COC bonus, reallocation plus COC bonus, and DV bonus. And it's an HMIS expansion that wouldn't have anything to do with DV. I'm just kind of stumped on that question.
Choose COC bonus.
Okay.
And then
Okay.
explain in your narrative, your beginning narrative about your project. I think
Yeah.
it's narrative 2.
Yeah.
That you're applying for unused PPRN.
Okay, perfect. Got it.
And everybody do that. Everybody's doing a new project and asking for non-DV specific bonus dollars. Make sure you just put COC bonus and then explain in your narrative right off the bat that you're asking for PPRN.
Okay. Thank you.
You're welcome.
So I'm assuming that was Robin that was just talking, even though I couldn't see, but you kicked it off. This is where we are. Q&A. So floor is yours. What questions do you have? We will be doing a separate DV webinar. I don't have a date for that yet. But we will push that out to you as soon as that day and time is set with a link. So most likely I'll say for now, any questions that aren't specific to DV bonus, let's start there because we'll have a separate webinar on that. Dreama, we answered every question.
Yay!
Okay, who's actually too scared to ask their question? I've been there, I get it. Don't be scared.
I just hate being the one to ask so many questions, but
Love it.
when we're in the process of completing our application, I know the applications are competitively countywide and then of course nationwide, but since we have so much money left on the table, opportunity for us to apply, are we allowed to contact you for assistance during the application prep process, or should we wait until after we have submitted and just see how it falls out?
Oh, yes, I get your question. Okay, so our answer is going to be opposite of what you typically hear, because typically with most grants, you can only write your questions and have to be submitted in writing by such and such date. And then after that time, they're like, you're not allowed to talk to us. This is the exact opposite of that approach. So if you think of it as like when I talked about the 14 bonus points that gets for this, the continuum can get as a whole, if you're submitting projects based on healthcare vouchers, housing vouchers or healthcare. What happens is anything that the CoC does, if it's one project applicant, if it's the CoC as a whole, we are a continuum. So the process, the goal is we want to help you as much as possible, because the more that one project is better, it benefits the entire continuum. So we are here, reach out to us as much as possible. Again, DREMA has more expertise than most people related to HUD. So you
Most
have
HUD employees.
yeah, seriously. Yeah. Utilize this resource. She's amazing.
Dr. Dawson, this is Cheryl. Just to kind of also reassure you, the county is procuring the consultant, North Star. So look at them as the Continuum of Cares team. So everybody can reach out for help on their applications for this process.
Okay, so should we do it through Kayla or to them directly? Because I want to follow the protocol.
So
Through
any kind of,
Kayla.
yeah, your questions, if you're going to email a question, or yeah, reach out to Kayla if you're going to email, just for public records reasonings. But DREMA and Stacy, I mean, if you guys arranged a phone call or something with an organization, Dr. Dawson, I mean, that doesn't need to be, I don't think that would need to be organized through Kayla unless you two think differently.
No.
Does that make sense, Dr. Dawson? So if you wanted
Yes.
to email something, email it to Kayla, she'll forward it to them. If you
Okay.
wanted to coordinate a call with them, we don't need to be necessarily involved.
Okay, all righty. Thank you.
You're welcome.
So y'all, that invitation extends to everybody. That's not just to Dr. Dawson. So use that. We are here to assist you however. Just run it first through Kayla and then she'll field it over to us and then we'll get you on your way.
I don't have any questions. I just want to give a big shout out to Stacy and DREMA with North Star for all of their hard work on this presentation. So thank you guys.
Oh, you're welcome, Dallas. And we are here, whatever you guys need. The only stupid question is one you don't ask. So it keeps you from having to back up and regroup. So ask away.
Carla is asking, where can you get the contact information for Stacy and DREMA?
So send it to Kayla first and then she'll forward it on to us just because of the public records. And then we'll just respond to you and we'll include Kayla in it, just because honestly, I don't want to have to keep track of every email for, county records because I'll forget some and I don't want to get the county in trouble. But just send it to Kayla and then we'll get you going. Don't worry.
And if you need one-on-one TA, like over the phone, just send Kayla an email requesting phone TA and we will set up a Zoom call with you or a personal phone call one-on-one.
And I'm just gonna say, I know we're out of time. If you need to jump, go for it. I will say, like, some of the TA Zoom calls we've done is I can't figure out how to set up my project on eSnaps. That is a thing. It is real because it's look for the button that moves, that isn't in a logical place. Start at the end to hit edit, go to the submit paper page to edit the first page. Like, it is not intuitive at all. So if you're like, I feel too stupid to ask the question, like, don't even let that be a stopping point for you because it is not intuitive. And don't get hung up on eSnaps because we'd much rather you invest your time writing your narrative than trying to figure out how to navigate eSnaps. So just reach out to us. We are around and then we will get information out to you shortly as to when we're going to do the DV specific webinar. But on that note, we are around if you guys want to give any other questions. Otherwise, we will let you continue on with your day and let us know how we can help.
Stacy and DREMA, can I have, when we get off or when this is over, I just have a couple questions for you guys.
Yeah.
I got your email and with the timeline and whatnot.
Okay. Yeah. If you want to just stay on, or I can just give you a call. Either way is fine.
Okay, perfect.
Okay, well, with that, I'm going to end this recording. It will get up on the website later on, so you'll have all of this available. Copy of the slide deck will be as well. So it has all the emails and the information you need. And again, reach out to us with any questions that you have. And thank you so much for your time today. And we look forward to helping you out.